Alright, Lillian, so we both had a chance to wash up our hands. Making sure that your hands are clean is always the most important first step. I also want to make sure that whatever surface you're working over is clean, and that if you're working over the sink that you plug the drain. Okay? So just make sure everything's nice and clean when you work with it. Want to reduce any chances of getting any kind of germs or bacteria or anything like that. So what we're going to begin with is I'm going to show you how to put the contacts in, and I'll show you how to take care of them, and have you take them out, and I'll have you put them back in again. So you kind of get to go through the whole process a couple of times, and I'll kind of watch how you go. This is the case that we're going to use. The prescription that we have for you is the same for both eyes. However, once you've put them in an eye, always make sure that the right lens goes in the right eye and it stays in the right side of the case. This is going to make sure that you don't pass anything from one eye to the other. Always being consistent with right in the right, left in the left. Also, as years go on, if that changes in the prescription, then it won't be confusing. You'll already be in that habit or that routine. So we're going to start by only removing the cover off of the right side. The reason that we do this is because you are right-handed, so I want you to always make sure that you put the contact in with the right hand, and you remember right side of the case, right lens first. That will be an easy way also to remember. The case is marked on the cover with an R, and it's marked at the bottom of the case with an R, but the left is not. So it's a good idea to always just leave the cover on the side that you're not working with. Then after you're done with the right, you put the cover on and only remove the left side. So you only have one open at a time, okay? So we're going to start with this lens here first for the right eye. And you'll see that they come in these little blister packs. And to open them, you always want to open them kind of away from yourself. I've learned too many times doing this, and then it sprays at me. So you want to make sure that you always open it away from yourself. If you want to go ahead and scoop that contact out of there, and it's going to feel kind of slimy, kind of funny at first, but I want you to get comfortable using it. Yep. Good. Then what you'll do at this point, see how it's kind of rolled over, is just use your other finger to kind of roll it open. You want to make sure you don't ever try to pull them apart. Alright. Now with the lens, you always want to take a look at the lens and make sure that there isn't anything wrong with it. You want to make sure there isn't anything on it, like a fuzz or no cracks, tears, rips, pieces missing, things like that. If that's ever the case, you don't put that in your eye. I'm going to show you a couple of things, so I'm going to take that from you. So when you look at the lens, you want all the edges of the lens to be up in the air. If any of the edges of the lens are stuck on your finger like this, it will end up staying on your finger and not going in your eye. So you want all the edges up in the air. There is also an inside out with these lenses because they're soft and kind of flexible like you saw. So the right way, if you look at it kind of straight ahead, it looks like the edges of the lens are very crisp, very sharp, and stand upright. I'm going to flip it inside out and show you what it looks like when it's inside out, and we'll see how well you can tell. Can you see that the edges are kind of flared open a little bit more? It's pretty tricky with the prescription that you have to see that. If you kind of look at it from a little bit of an angle, you can kind of tell. Can you tell the difference or not really?
I can tell.
You can tell? Okay. So the other way is what we call the taco test. This one's kind of fun. What you want to do with this is actually fold the contact like a taco. There's a couple ways that you can do it. You can do it between your thumb and your finger like this to form a taco, or you can put it right here in this crease of your hand. And again, pardon me, do that same thing where you just kind of give it a little bit of a bend, and if it is, I'm going to do it actually in my right hand. You can kind of see that when you're doing this, that it forms a taco. If it's inside out, what it's going to do is actually flip back onto your hand. I'm actually going to get this lens a little bit wet again too. It's starting to get fairly dry. Same thing. Now, see what happens when I go to fold it? It just kind of flops backwards onto my hand. Same thing then when you do the taco test with your fingers. It doesn't form that taco, but it folds between your fingers. Okay, so that's one way that you can know that it's inside out or not. Might be a little bit easier to tell that way as opposed to just looking at the edges if you're ever concerned about it. I am going to go ahead and fill up that case with solution here so that you can take the contact right from there. Alright. So then I'm going to have you go ahead and scoop that contact out of there again. Yeah, you're doing a great job handling it, just very gentle with it. That'll keep it from tearing when you're nice and gentle like that. Good. Excellent. Alright, So now what you're going to do, I'm going to show you really quick first, and then I'll talk you through it when you do it. What you're going to do is use the pointer finger on your left hand to come up above, and you're going to hold your top lid and lashes. It's usually easiest if you can get right along that lash line, or even get the lashes themselves and hold them up against that bone inside your eye. Like this. Then you use the middle finger on the other hand to grab the bottom lashes and pull the bottom lashes down. You're going to look right straight ahead at first and kind of look in the mirror when you do this and see, okay, does that look like I've got my finger in just the right place? Then when you know that you have your finger in the right place, you're going to look up and then bring the finger straight on that way. Okay? So let me kind of talk you through it as you go along. So first use your left hand to reach up and pull up on your top lashes. Good. I know it feels kind of funny. Good. Then use the middle finger on this hand and pull down your bottom lashes. Excellent job. Good. Get your finger in the right place. Good. Now look up. Good. Bring your finger straight forward and touch your eye. Good. Keep coming just a little bit more. You're almost there. Almost. Just touch your finger. You're a little nervous about it? It's okay. No problem. It takes a little bit of getting used to. You can do it. Good. You're getting your eye open really nice and big. That's fantastic. Good. Yep. Look up. Good. Bring your finger straight forward. Good. Yes, a little bit more. You're going to want to feel the pressure of your finger on your eye. Yeah, that wasn't bad at all. Go ahead and put the contact in the solution for just a second. We'll get it nice and wet. Okay, I really encouraged you. You did such a great job getting your eye open, and the position of your finger was perfect. You're just going to want to bring your finger to actually feel the pressure. I'm going to give me your hand for just a second. You're actually going to gently feel the pressure of your finger on your eye. You're touching the white part of your eye, which isn't quite as sensitive as the colored part. It's actually what's over the colored part that's sensitive, but it's clear so you don't see that. When you're looking up and touching that part, it's a little bit easier because first of all, it's not as sensitive, and then also you're not looking directly at yourself when you touch your finger to your eye. So are you ready to try it again? Maybe. Go ahead. Give it a try. Scoop it out of there. I'm really quite convinced that... What's that, honey?
I got it.
Oh, good. I'm really quite convinced that once you kind of get over the anxiety of having to touch your eye, you're going to get this really, really well. Good. Yep. So same thing. Yeah. Top lid. Nice job. Bottom lid. Good. Good. Hold on one second here, Lil. I'm going to just move this up this way just a little bit. It'll give you a little bit of a better angle for that. There you go. Nice job. Good. Look up. Good. Bring your finger to your eye. Good. Touch your finger to your eye. Go ahead. Go for it, sweetie. Go for it. Look up and touch your finger to your eye. Boy, you're a little anxious about it, aren't you? It's okay. You're not the only one that has had that experience, so don't be afraid. Good. Look up. Good. Yep. Touch your finger to your eye. You almost had it. Good. You can kind of feel the coolness of the lens on your eye. It makes you want to blink. Yep. So you are wearing makeup in today, which is fine. We see that. Typically what you're going to want to make sure that you do at home is that before you put your makeup on, put your contacts in first, and then be very careful not to get the makeup in your eyes at all, which obviously that's kind of a pretty common thing. You don't want to get makeup in your eyes, but making sure that you don't have makeup on your eyes before you put them in is going to prevent them from getting anything on it. Although I don't see anything on the lens right now. You can go ahead and scoop that out of there again. Yeah. You got it. Good. Nice and gentle. Yeah. Good. One thing that you can do, if the contact might stick to your finger with it as wet as it is right now, so I'm just going to show you a tip as far as for drying it off a little bit. Move the contact onto the other hand, then take this finger and dry it in the palm of your hand. Typically your skin is going to be lint-free as opposed to like wiping it on a towel or even on your pants. So if you dry this finger just a little bit in the palm of the other hand, yeah, it doesn't have to be completely dry, but you see what a difference that's going to make, and that will help the contact stick to your eye instead of onto your finger. Alright, go ahead and give it a try again for me. Good. Excellent. You do such a great job with this. Good. Yep. Look up. Good. Bring your finger straight forward. Oops. Oh, almost. Good. Because it fell, you always want to make sure that you clean it off. You want to make sure that anytime that it falls, even though you are working over a clean surface, that you do put it in a solution and give it a little rinse off. We want to make sure that there isn't anything on it. And then once you take it out of there, go ahead and take a look at it again and just make sure that there isn't anything left on the lens. Looks good. Is it moving a little bit? Okay, it's just a little bit wet on your finger. So do you remember how you changed that? Yep.
Crap. There's makeup on that finger.
Oh, that's all right. No problem. If you want, let's just grab another towel. That was the finger that you were using to lift your top lid. So you're doing just fine. Take a deep breath. Exactly. You're doing great. Yeah. You're very gentle with handling the lens, so I'm very impressed by that. There you go. Perfect. Yep. Good memory. Good. Yeah. And then look up. Good. Touch your finger to your eye. You got it. Just go for it, girlfriend. Go, go, go. You got it. Touch, touch, touch. Almost. You almost got it. You're doing good. Look up. Good. You're doing just fine. Good. Good. You got it. Getting more anxious about it? Good. Yep. Look up. Good. Touch. Touch.
You get it.
It's alright. Do you want to try the left eye instead?
Yeah.
Okay. Let's go ahead and give the left eye a try. Okay. Absolutely. No problem at all. So remember now I put the cover on the right side. Don't want to get confused. Go ahead. Yep. You had it on there. Did you feel it? Yeah. Good job. Now same thing. Now you're working with your left eye, but you're still going to use your right hand to put the contact in. Still going to use your left hand to get the lids up. You're working over your nose, so it's a little different angle. But go ahead and give it a try. Let me kind of just watch, and I'll talk you through it as you go. Top lids. Good. Yes. Grab the bottom lids a little closer to the lashes for me. I'll help get your eye open a little better. There you go. Yep. Go forward. Good. Touch your finger to your eye. You got it. You got it.
I moved. There's stuff on there and the bubbles.
It looks like it's just some of the solution. Yep, I'm not worried about that. Good. Go for it. Yep. Courage. Look up. Good. Touch. Touch. You're getting it. You're getting it. Hey, that was good. Go ahead and grab that and stick it back in this case here. I'm going to take that solution and stick that over there. Fill that up. You see those little bumpy lines? The little bumpy lines are kind of a good measuring tool, so you fill the case to the bumpy lines with the solution. Alright. You really, honestly are doing just fine. Don't feel discouraged. Some people, it just takes a little bit more practice to get comfortable with the idea of touching your eye, but once you get over that, it really, I think once you've got the contacts in once, you'll go, okay, this isn't so bad, I can do this. Yes, good. Good job taking a look at it, too. Very good memory. Good. You got it. Yeah. Hey, you got closer that time. That was good. Every time, just a little closer. Yep. Good. Look up and touch your eye. Good. You got it.
I feel like it's going on there crooked.
Oh, yeah. Nope. It will. It's soft, so it's going to kind of move around just a little bit, and that's okay. Yep. Good. Yep. Touch your eye. Yep. It's all right. You're getting there. You're getting there. Look up. Good. Touch your eye. Touch your eye a little more. What you want to do is make sure all the edges of the contact touch the white part of the eye, and kind of give it just a little bit of pressure from your finger so that all the air bubbles from underneath it kind of come out. So it's going to work a little bit like a suction cup. Stick right to your eye. Yes, good. Want to move it up just a little bit higher on your finger? Sure. Move it up there. Nice job. Yes, good. Look up. Good. Touch your finger. You almost had it. You're good. Keep going.
Make sure it's lined up.
Yeah, good. Yeah. Good job. Almost. You're good. Touch your finger to your eye. Almost. You almost had it there. Good. Good. You're getting closer. Getting closer. A little bit of pressure. Hey, you had all the edges of the contact on there. We just want a little bit more pressure from your finger to your eye, but that was by far your best try yet. How you doing? Okay? You're doing a good job.
There's a fuzz on there.
Yes, good. Yeah, go ahead and just kind of clean that off a little bit. Yep, and if you actually take it out and just kind of rub it a little bit this way, kind of a back and forth motion, that will help get any of the fuzz or makeup or anything like that that could be on the lens. Take a look at it, make sure it's the right way. Yep, and make sure we got that fuzz off of there. Looks good. Good old makeup, right? Makes you look glorious as long as you, or glamorous, I mean, as long as you don't have it everywhere. Yeah. I'll help you out. If you, yeah, that's all right. There you go. Yeah. Yes, there you go. Oh, so close. You really felt the coolness of it on your eye, didn't you?
I have makeup on my fingers.
I think your thumb looks good. Yeah. Good. Yes. Almost. It landed right here in your scarf. So let's go ahead and get it back in the solution. Let's take a look. Oops, it's on your finger still. Let's take a look at your fingers here and just kind of make sure that we get the makeup off of your fingers too, so that as you continue, I'm just going to give you a little bit of the solution on your fingers, and then if you want to go ahead and use that paper towel there to just kind of wipe it off. Yeah. It takes a certain level of bravery, doesn't it? Yeah. And just overcoming that uneasy feeling of touching your finger to your eye. Which lens do you want to work with, the right or the left?
The right.
You want to go back to the right? All right, that sounds like a good idea. And just clean up this case really quick here too. Good. Excellent. Touch your finger to your eye. Almost. If you do it a little bit quicker, it'll come less as a shock to you. Go straight forward. Straight forward. Touch. Good. Hey, not bad at all. That was fantastic. Well, let me give you the next stage of the game, the next step, because I think for you, once you've got it on there, you're going to want to know what to do next because it's going to move. All right. Despite our little glitch with the camera, we are going to go ahead and continue to have you try to put the contacts in. So let's go back at this again. Whenever you're ready, actually, you know what to do here, so I'm just going to keep watching you. You go ahead and grab that contact and give it a try. And this is still the right lens. Good. Yeah, you notice that it flips. So this will be a good time to just take a look and make sure that that contact is the right way, because they are soft and they can flip. Not really sure, or you think it's inside out?
It's inside out.
Yep, you were exactly right. So then try it again. Whoops. Give it a rinse off. Yep. Good. Go ahead and scoop it out of there. Yep. Take a look at it now. What do you think now? Yeah, it definitely looks like the right way. That finger might be just a little bit wet, so you probably want to put it on the other hand. Yep. You got it. Alright. Now back to the right eye again. Good. Yes. Good. Excellent job. Bring your finger forward. You got it. You got it. Good. Touch your finger. No. Remove your finger and look towards the... Oh, almost. Just a little bit too big of an air bubble under that lens. That's why when you closed your top lid that it smooshed on there. And go ahead and scoop out of there. Good. Yeah. Good. Touch your finger. Bring your finger up just a little bit higher. Whoop! Look at that powerful blink you've got going on, honey. Good. So let's just talk through this again because I want to kind of give you the full view of what's going to happen. You've got a very quick response. So I want to talk through just a little bit more that I didn't tell you before because I said, oh, let me talk you through it. So when you put the contact on your eye, you're going to go ahead and take your finger off your eye and look towards the lens as you let go of that bottom lens, and then try very carefully to just close your eyes really slowly, like you're drifting off to sleep. If you close hard and fast, which might happen naturally, but if you do it, it can push that lens out, which you've seen happen a couple times. Try to just relax and slowly close your eye. The other thing to know is that it's not uncommon to kind of just feel that lens a little bit, have a little bit of a sensation like, oh goodness, there's something there. But once you've got it on and your eye closed, just leave it closed and I'll talk you through it. So go ahead and scoop that out again. Good. Yep. Good position, yes. Excellent. Good. Look up. Good. Touch your finger to your eye. Good. A little bit more pressure. You got it. Just a little bit more. Good. All right. Still too big of an air bubble under that lens, so it's kind of on your lids. Yeah. Yep. You're going to want to give your finger just a little bit more pressure from your finger to your eye. Just kind of that gentle pressure, okay? It's not going to hurt your eye in any way. It will feel kind of funny, but it's not going to hurt your eye at all. Good.
This finger's a little wet.
Yep, that's all right. Good. Yep, look up. Good. Touch your finger to your eye. Nice and firm. Nice and firm. Give it a little bit more pressure. Yep, let go of that bottom lid. There you go. Let go of the bottom lid. Close your eye. Just close your eye. Just close it like you're falling asleep. And then with your finger, tap along your eyelashes. You want to make sure not to rub them, but just tap along your eyelashes. Good. Good. You want to take a look? Do you see there's still a little bit of an air bubble? Yep. Blink a couple times. Yep. Making sure you're just looking towards the lens. Good. Do you see where the lens is on your eye? Can you kind of see the edges of it? It's just past the colored part of your eye. Do you see that? Good. Is it uncomfortable, or is it just kind of feel like there's something there?
Just kind of feels like it's on there.
Good. If ever you put it in, it's like, oh, that's kind of uncomfortable. You can try to just slide the lens off to the side just a little bit and then blink a few times. It will move back into position, and usually if there is something kind of right at the edge of the lens, once you slide that over, it will let loose whatever might be at the edge of the lens. How you doing? Okay?
Yep.
Yeah, I'm impressed. You did it. Let's go ahead and switch over to your left eye then. We're going to go ahead and give it a try with your left lens. So go ahead and scoop that out of there again for me. Good. You're doing great. Yes, touch your finger to your eye. You're doing an awesome job. A little bit more pressure. Good. Take your finger off your eye. Look towards the lens. Let go of that bottom lid and close your eye. Oh my goodness. All you had to do was try it once and you got it. Look at you. Nice job. I'm super impressed. You can, yeah, good. Take a look at it. Do you see where it is? Is it uncomfortable? Painful at all? No. Good. Okay. Excellent. Kind of got to get used to it. Yeah, does it kind of feel like there's something there, right? Yeah, good job. Nice work. Excellent. Well, let me kind of go through how to take care of them before I have you take them out. So what you're going to do is make sure that after you take the contact out, you're actually going to put it in the palm of your hand and you're going to clean the lens. So you use some of the solution to put on the lens and then just rub it back and forth for about 30 seconds. You're going to kind of like, if you think of the spokes on a wheel, kind of go around a little bit, back and forth. Don't go circular. That can cause the lens to ball up and tear, so just back and forth, about 30 seconds. And then you're going to take that contact, hold on to it, and rinse it. You want to make sure that when you rinse that lens, that if you're working over the sink, plug the drain. Make sure that whatever surface you're working over is staying clean, so that if the lens falls, that it's not going to get dirty again, right? So just clean it. And then you're going to put it in the case with clean solution. It's always important not to reuse that solution. This solution actually disinfects the contacts while it's stored in there, so it gets all kinds of, bacteria and germs and things like that off of the lens, and then it's sitting in the solution. So obviously you don't want to put a lens back into that kind of solution. Dump it out, let it air dry. So what you'll do, and I'm actually going to go ahead and dump this solution out since you've got both of your contacts in, is just let it dry, covers off throughout the day. All right. It's a good idea to clean the case periodically as well. You want to make sure that that you use just a mild soap like you use with your hand soap, nothing that has any kind of a moisturizer or lotion or anything like that in it. Actually, I've got a little checklist. Let me kind of go through these things with the checklist. This will just be something for you to take home. And there's a garbage right underneath us here too, so you can throw those away. Thank you, sweetheart. So let's go over this again. We'll start from the top, and that way I'll kind of talk you through this list, so when you go home, you'll know exactly what I was talking about. So always wash your hands before you take the contacts out or before you put them in. It's very, very important that cleanliness remains so that you don't get any eye infections. Use a soap that does not have a moisturizer or a lotion in it. Take a look at the contact before you put it in, like you've been doing. You've been doing a great job with that, really making sure that there isn't anything wrong with it. Don't ever use a contact that has something wrong with it. Take a look at the lens and make sure that it is the right way, that bowl shape. Remember the taco test that we talked through? You can do that. Be consistent with keeping the right lens in the right eye and the right side of the case. We talked about this, but this is just your reminder, like I said. This gives you a quick refresher on how to remove the lens, and I'll go through that with you in just a minute. So that will be for your own information. After you remove the lens, you're going to place it in the palm of your hand, rinse it, rub it, clean it, right? Place it back in the case. Make sure then that you're doing that one side of the case cover thing too, just cover the side that you're working with. You want to make sure that you do clean your case about every week, and it's a good idea then to rinse it really, really well. Make sure that there isn't any soap residue left on the case when you clean it. And then doing that about once a week is a good idea, and then replace the case. This says replace it about 2 months. Typically my suggestion is you're going to get a big bottle when you purchase the solution. Replace the case when you replace the bottle of solution. Then you don't have to keep track of time so much. You'll just know. New case, new solution. When you're wearing the contacts, make sure that you dump it out, just like I had explained just a couple minutes ago, and allow the case to dry completely. And then always store it with fresh solution. These contacts are a disposable lens. These are recommended for bi-weekly replacement. So every 2 weeks you're going to replace the lens. Easiest way to remember to do that is to pick a day of the week and always replace it on the same day of the week. So if you start wearing the lenses on a Friday, replace it every other Friday, and that will be just a really good and easy way to remember. Don't try to stretch that out. Don't try to make it last longer just because they're comfortable. They develop deposits on the lenses after some time. That material starts to break down some, and that can increase your risk of an infection. So even if they're comfortable, get rid of them and start fresh, okay? Replacing the contacts as scheduled is really, really important. And then also maintaining cleanliness is going to help prevent any kind of an eye infection. The other thing that will really make a huge difference is remembering to never sleep in your contacts. Never overnight sleep in your contacts. Take them out, okay? It is very important that you do that. If you experience any of these symptoms that are listed here, redness, obviously the first couple of days as you're learning how to put them in, how to take them out, your eyes might have a little bit of a pinkness to them, but after that, blurry vision, crusty, mattery, any kind of yuck that comes from your eyes, if they become painful or sensitive to light at all, like if you want to wear sunglasses even inside, those are good indicators that there's something a little bit more serious going on. We want you to take the contacts out and give us a call right away. The numbers are right on our list. The doctor's cell numbers are listed right on our voicemail. So if it's a weekend or a nighttime, have your parents call us and we'll get you set up right away to come in and see the doctor so we can take care of you. That'll be yours. Do you have any questions at this point? Okay. The other thing I was going to mention too with solutions is that I'm actually going to send you home with a sample of the solution as well as the case because we want you to use this in the next week or so. This is the solution that the doctor has recommended because it's very good at doing all the things that we needed to do to clean the lens, to disinfect the lens, and it's safe for storage as well. So this will be what we want you to use if you do end up needing to buy some before you come back in. As far as taking them out, let's go through taking them out. Now I'm going to get another tissue paper, or a napkin here. So what you're going to do as far as taking them out, there's a couple ways to do it. I'm going to show you one. We'll see how it goes. If we need to change it up, we can change it up. Again, always be consistent, right eye. To start with, and I'm going to show you quick, and then I'll have you actually try it. So the contact actually sits just past the colored part of your eye. What you're going to do is watch in the mirror when you do this. You're going to grab those bottom lashes with the pointer finger on your left hand. Grab those bottom lashes. Use the pointer finger on your right hand to pull the contact down off the center of your eye. Like I said, you don't have to go right in the center. You can actually just come right towards the edge. So pull it down off the center and hold it there. If you let go, the contact's going to go back up where it belongs. So you're going to want to pull it down and hold it with your finger, and then come in and pinch it between your thumb and your finger. You want to make sure not to use your fingernails, but the actual skin of the fingers, okay? So pull it down and pinch it, and I'll talk you through it as we go along. So let's go ahead and give it a try. Watch in the mirror when you do this. Good. Yeah. Good. Pull it down off the center. Good. Good movement. Did you kind of feel it move a little bit? Good. I was going to tell you too, if ever it feels like it's really dry, like the contacts aren't moving, sometimes at the end of a long day, especially if it's dry, that contact might not move very easily. So if you try it and it doesn't move, use a drop of the solution in your eye to help get that lens a little bit loose. So go ahead and give it a try again. Good. Nice job moving it. Good. Pull it down off the center. Good. And then come in with the thumb to pinch it between your thumb and your finger. Good. Yeah. Pull it down. Yeah, almost. You want to get it really down far. Good. And then pinch it between your thumb and your finger. You got it. Yeah. Almost. It's going to need just a little bit more pressure. Let me just show you on the back of your hand. When you go to grab it, you'll kind of just feel it like that. Okay? That's not going to hurt your eye at all. Good. I'm actually going to get your case ready here while you're working on this. You're doing a great job. Good, good, good. You had an air bubble in it that time. That was almost. Good job. Good. Almost. Get in there just a little bit more. Yep. Use the pad of your finger. Good. You're doing a great job here. Good job, Lillian. Yep. Pull it down. You got it. There you go. Pinch it between your thumb and your finger. Good. A little bit more pressure between your thumb and your finger. You're not quite giving it enough pressure. A little bit more bold. A little bit more aggressive. Almost. You're doing fine. You got it. Good. You want to try the left eye for a second? Let's give that right eye a break. I'll put the cover back on the other side. It's a good idea to have the solution ready in the case when you go to take the contacts out. That way you can just slip it in there. Okay. Yes. You'll get it. You'll get it. You're doing great. You're doing great, honey. Good. You're doing great. Pull it down. You're doing great. Pinch it between your thumb and your finger. A little bit bigger movement between your thumb and your finger. Yeah, you got it. Got it. You got it. Almost, almost. Almost. You had a really good wrinkle in it that time. That was very close. You feel it kind of moving around again. Yep, you're doing great. You see where it is? Good. You're doing so good, hon. Pull it down. It's alright. Good. Pull it down. Good. Almost. Ooh, almost. You almost had it there. You're doing great. Almost. Almost. A little bit more pressure. Thumb and finger. Thumb and finger, get in there. A little bit more. A little bit more. There, there, there. Ooh, almost. That feels really funny, doesn't it? Pull it down off the center. You got it. Nice job, honey. Excellent work. It feels really awkward to pull it off of there, doesn't it? So good. For right now, yes, you can go ahead and just stick it in here. You want to make sure that it's always sitting at the bottom of the case and that there aren't any air bubbles in it. I'm actually going to just kind of move that upside down. If the edges of the lens are up on the case at all, when you go to put the cover on it, it could get stuck in the cover and tear the lens. So you always want to make sure the contact's completely submerged at the bottom of the case. All right, give it a try again with the right eye. Good. Yep. And then pinch it between your thumb and your finger. Oh, you got it. Look at that. See, you just seem to have to do it one time and then you're good. Let's actually clean this contact. So I'm going to have you go ahead and take that one. Yep. Oops. Put it in the palm of your hand for me. Sure. Yep. And then go ahead and put some of the solution on there. Yep. And then go ahead and rub it back and forth. Excellent. Good. Nice. Yep. Good. You're doing just the right amount of pressure there as you try to clean the lens. You can kind of feel it slop around a little bit. You can work over the paper towel here so you don't get your lap all wet. Good. Yep. And then go ahead and give it a little bit of a rinse off there. Do you remember how I suggested that you do that? Yep. Just kind of hang on to the edge of it and give it a little rinse off. Yep. Good. Yep. And then you'll put it in the case with the clean solution. Nice job. Excellent work. I'm impressed. Very impressed. Do you have any questions at this point, Lillian? All right. So are you ready to put the contacts back in again? All right. Good deal.